Hello, muscle whisperers, and welcome to part 2 of how to treat neck conditions. With the client in the prone position, warm up the tissue, and once the tissue is warm, use sustained controlled pressure along the length of the upper traps, following the fiber direction to help release chronic tightness and restore mobility. The trapezius muscle has a diamond shape that starts from the base of the skull towards the shoulders. While working on the trapezius, you can divide this muscle into 3 sections: upper, middle, and lower. Next, we can move to the suboccipital muscles, which is at the base of the skull. These small yet powerful muscles are often tight in clients with forward head posture or restricted cervical movement. Use gentle compression or circular fiber movements, and this can help reduce the tension and improve range of motion. From here, you can address the levator scapula. You can sink into the upper neck near the transverse processes and trace the muscle fibers down toward the inside border of the scapula. This muscle often shortens with stress and poor posture. Some techniques that can be used on the trapezius and suboccipital region is soft tissue mobilization. This technique involves applying sustained pressure with your fingers or thumbs to the suboccipital muscles, which is right at the base of the skull, and this releases the tension and improves blood flow. For soft tissue mobilization for trapezius, I'm using the pincer grip, just pinching and slowly moving the fibers inward and outward, up and down for the upper traps. While I'm able to release the upper traps, I'm also using my thumbs at the insertion point for the levator scapula and serratus anterior muscles. Because of where these muscles live, I'm able to work on multiple muscles at one time. Here, my focus is on the rhomboids, but we have the erector spinae group that lives here, as well as the middle trapezius muscles. I perform these techniques several times using my hand to do effleurage to flush out the area and go back to doing manual therapy to loosen the specific muscles. I also change my positioning to target the muscles in multiple directions. I perform a scapular lift by sliding my fingers under the medial border of the scapula with both hands, gently lifting the scapula away from the rib cage. This technique helps release adhesion between the scapula and the ribs, increasing the scapulothoracic mobility and creates more space for surrounding neck and shoulder muscles to work effectively. While lifting, I guide the scapula through small controlled movements for more complete release. I performed the scapular lift several times until I was satisfied with the shoulder movement. I perform a myofascial stretch along the rhomboids and middle traps. I use my thumb to target muscles that felt ropey and tight, and then move on to the upper traps. I also work along the cervical erector spinae muscles, starting from the base of the skull, moving down toward the thoracic region. I use long, lengthening strokes to restore balance and reduce tension throughout the neck. I finish by blending my work into the upper back and in the shoulders, leaving the client with an improved posture, reduced tension, and a greater sense of freedom in that upper cervical region.